chairman, why can't we introduce cancer study in the subject? Well, you know that anything you move, there is opposition. In the society, including science, if you talk the facts, before the public accept, it takes time, it is very difficult. And the scientists said those days, the blood is not constant, it is moving in the body. I think it was in the Rome, he was hanged because he is talking something unauspicious. Here what happened, my senior members of the board of studies opposed it. In what way cancer biology connected to this? Then I told them, when a student is studying all the normal cells, it is easy for him to identify where the abnormal cell is there. It's very simple. And they agreed. Now you won't believe, throughout the country in life sciences, the cancer biology component is there. And I am proud to say, my first batch out of 12, 4 students got fellowship in CRI Bombay, Cancer Research Institute, Parel, Bombay. And they finished their PhD. Of course, they're all in states. In Kidwai, few students were there in the beginning. Now I don't know where they are. So in this junction, I want to tell the directors, well, you are doing research, you are doing practice, you must be doing the documentation also. But my request is, see that 1 or 2 scientists, qualified scientists are appointed here, like Kidwai, so that, or like what you call CRI, so that they can make use of the material what doctors are getting, and they can do work so that there will be progress in the field of cure. So that is very, very important. Now regarding the treatment, I don't want to talk anything, but I wish and hope that this hospital get the PET CT as early as possible, because to my knowledge, that is the one which gives very, very precise the observation of the affected cell. I am sure when they have done all these things, they'll do this also. And gentlemen, you may be knowing, nanotechnology is taking shape, and nanotechnology, what my hope, it is not the nanotextile, textile or the tiles, so many things are there. But what we want is nanotechnology which lead to nanomedicine, so that medicine can go and hit the target cell. So the days are not very far. It's a hope not only for cancer, for all many diseases, the nanomedicine will come into force, so that this will be helpful to many, many the sufferers. Well, regarding cancer, one word, that is the physical agents, biological agents, chemical agents, and I am telling you, it is very difficult in a short time explain these things. Moreover, you must be hearing the genetic background. Out of 20 to 25,000 genes in the genome, nearly 300 have been proved. They are in the back or serving as an oncogene for the produce of the cancer. But cancer gene alone will not produce cancer. It is the environmental factors like food, etc., which will accelerate this growth. Anyhow, with these few words, I wish the directors, the investors, and the victors all the success. May God bless all of them. Thank you, thank you, thank you.
Thank you, sir. Now I request Dr. Rohan Gatti, a surgical oncologist, to introduce our chief guest, Professor Dr. M. Vijay Kumar.
Respected dignitaries, dear friends, cancer victims and colleagues, on this occasion, it's an honor for me to introduce Dr. Vijay Kumar, who is the director of Kidwai Memorial Institute of Oncology. He needs no introduction in the field of surgical oncology. He is a very well-known personality. Professor Vijay Kumar graduated MBBS in 1979 from Chengalpattu Medical College, Madras University. He got his DNB in general surgery in the year 1985 and completed his MCH in the surgical oncology from Kidwai Memorial Institute of Oncology, Bangalore in the year 1993. He worked as a surgical oncology training in Tata Memorial Hospital, Mumbai, Cancer Institute, Chennai, and in UK for photodynamic therapy. He still continues to do his research, and he's applied for registration for his PhD in TP53, that is a particular tumor suppressor gene study in esophageal squamous cell cancer. He actually has got 4 main roles in Kidwai Memorial Institute of Oncology. One as a teacher, the second as a patient care provider, the third as a researcher, and the fourth as a director. As a teacher, he does faculty training for the surgical oncology, radiation, medical oncology, as well as the allied sciences with that. And many surgical oncologists in most parts of India and some parts of the world are trained and inspired, this is important, inspired by him. He's an exceptional teacher and who inspires his students. And to quote an example, I can tell I still have his notes. I had been there for a short stint of 2 months, but whatever principles he has taught me, I still remember. So that is the influence he keeps in his students. So as a patient care provider, what I can tell is he's an excellent decision maker, and some of the difficult decisions among us, especially among the surgical oncologists or in oncology field, if we need a final opinion, we usually go to him. So that's the place where he stands. And he has operated on all the solid organ tumors, and his skill is undisputed, and it's the best what I have seen till now. Dr. Vijay Kumar is a well-known and a distinguished researcher in the field of surgical oncology, and to quote his achievements is very difficult in this short period of time. I would just try to focus on very few of them. He's involved in major international and national research projects, and to name a few among them, one is the Atlas trial in breast cancer, a very big project, Terry Fox project on oral cancer, phase 2 trials in interferon alpha 2b in advanced colorectal and rectal cancers. He has worked at various capacities in the professional bodies like Indian Society of Oncology, Indian Association of Surgical Oncology, Association of the Surgeons of India. He has published many research papers, more than 40, in various subspecialties of surgical oncology. He has authored various chapters in various textbooks and has presented many papers and has received many awards. I cannot actually compile it. It is impossible to sum his contributions to surgical oncology. In short, what I can tell is, here we have a very distinguished personality in the field of surgical oncology, and his contribution will be remembered for a very long time by his colleagues, students, and all of us. So I now request this distinguished personality and the director of Kidwai Memorial Institute of Oncology to tell a few words of advice to us. Before that, I would request Dr. Krishna Prasad to hand over a memento to him. Thank you.
The stage is now open to Professor Dr. M. Vijay Kumar.
ನಮಸ್ಕಾರಗಳು. ಲಾಸ್ಟ್ 3 years ಆಗಿ ನಾನು ಕಿದ್ವಾಯ್ ಮೆಮೋರಿಯಲ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಆಂಕಾಲಜಿಲಿ ಸಂಸ್ಥೆಯಲ್ಲಿ ನಿರ್ದೇಶಕರಾಗಿ ಕೆಲಸ ಮಾಡ್ತಾ ಇರುವಾಗ ಒಂದೇ ನಮಗೆ ಪ್ರಾಬ್ಲಮ್ ಆಗಿತ್ತು, ನನಗೆ ಅಟ್ಲೀಸ್ಟ್. ಯಾವಾಗೂ ಪಾಲಿಟಿಷಿಯನ್ಸ್ ಇರ್ತಾರೆ, ಸೊ ಈಗ ನಾನು ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ನೆಲ್ಲ ಆ ಥರದ ಸ್ಟಾರ್ಟ್ ಮಾಡಬೇಕು. ಇಲ್ಲಿ ಆಗಮನಿಸಿರುವ ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರಗಳು, ವಂದನೆಗಳನ್ನು ಹೇಳಿ. The real talk from my heart cannot come, but I am happy today that I am able to speak out what I want to speak, because there are no politicians here, for which I should be thankful to the organizers. Otherwise I can't be speaking what I have to speak. It's very unfortunate that many times they don't like what I have to speak, because truth always hurts many. And before I come to that regular talk of mine, here everybody is looking very serious. I am not a very serious person when it comes to inaugural functions. An inauguration is a joyous occasion, and you should be happy that there are some people who are joined together and bringing an institute for which you should be happy. I don't know why everybody is so serious here. ಇದು ಮುಂಚೆ ಹೋಗಬೇಕಂದ್ರೆ ಇನ್ನೂ ನೀವು ಇಂಟ್ರಾಕ್ಷನ್ ಬಂದಿಲ್ಲ ನಾನು ಮಾತಾಡೋದಕ್ಕೆ ಅಂತ ಅನಿಸುತ್ತೆ. So many victors I am seeing. I have to tell you before going to the actual part of my talk, when I was seeing so many victors, what happened to me as a cancer surgeon. I joined the institute in 1984, and 85 or so as a junior surgeon, I was involved in a cancer surgery, breast cancer, to a lady whose daughter is actually budding doctor. She went home well. After a year, somewhere I was happy to see her and I went. I don't know what you would have known now why I am talking this. She just did not bother to even acknowledge that we did some surgery and she is happy. That is the type of impact cancer has given to individuals, as though it is a untouchable one or it is a sin to have cancer. Today, I am very happy that Mangalore Institute of Oncology people and directors and the investors have decided to call the people who have survived their cancer to come and inaugurate, and I am happy and thankful to those who came. I have invited any number of times. There is a day called your Father's Day, Mother's Day, Children's Day, like that. There is a Cancer Survivor Day. For that, many times I have called them on the phone. Many times they will only shy away because they won't come and say, I suffered and I have come out of it. And I'm happy that there are at least 1 dozen of them are sitting and coming and telling. That's a positive thing to see. Maybe thanks to Yuvraj Singh, who made a big impact. I don't know. Maybe it is Yuvraj Singh, maybe others. But I feel Yuvraj Singh made a big impact, though it's an unfortunate event, which even I was asked to comment by one of the TV channel. Because that is the impact he made, that all over the country, as though cancer is a new disease we are talking about, just because one celebrity got and came out of cancer. That is the impact today. That the changing scenario is because of a few people like Mr. Yuvraj Singh and so many people who are sitting here as the cancer victors. And see that teacher who came and said that I survived, and I am standing in front of you proudly showing her kid. That would not have happened 30, 40 years ago. That should change. And that is changing. I am happy to see the change and be a part of the change. And you are a part of it, and for which you should also be happy. As I move on, that I am talking about it, suddenly what is the message Dr. Rohan Gatti is expecting from me? I have no message. I am not Yuvraj Singh as a celebrity. I am a poor surgeon doing my work as in cancer surgery for 30 years. For only thing is, what I was worried is, when you come on to the dais, whatever the way they are introduced, I should have said thanks and gone. Maybe at least some of you at least will remember something about it. By allowing me to speak, I am going to spoil the show. That I am very sure, because I am going to talk something hard which many people won't like to listen to. See, the cancer is another disease which is coming up in a big way. As Dr. Suresh Rao said, how many of you, when he rattled the statistics, gave the patient hearing? We are still talking about eradicating of communicable diseases like, say, dengue fever is going on, and we are seeing even malaria and filariasis is still going on in our country, but that's a part of the tropical problem. But we cannot be concentrating only on that and say non-communicable diseases should have backseat. This is what the warning came from WHO, that is World Health Organization. Today, the government of India has responded to it by forming what is called as NPCD's program. I am not trying to teach you anything, but I am telling you the importance what the cancer has got. Today, by 2030, what is going to happen is what we are worried, and futuristically, if you remember, this is what is going to happen, and now this is the right time or the right time that the technology comes to Mangalore. By 2030, we are going to see more of diabetes, more of hypertension and cancer, rather than communicable disease which we are talking about. At that time, we cannot wake up and then start wondering what to do. So at least few things what we may have to do as individuals who are sitting. I never miss a chance of talking at least 10 public people who are sitting in front of me. The idea is that what you can do and what you should do for yourself and for cancer and for the society at large. For yourself, and so many of you are here, every day you are seeing nowadays, even the FM radios are talking about cancer awareness, and above 40 go for a test, etc. To tell you, because this will be a serious tone, so I don't want to talk seriously, a little more on lighter tone. A study was conducted in UK among the nursing students, asked them how many of them know breast cancer. Everybody said yes, we know. They asked, how many of you know that breast cancer screening program goes on in UK? They said, we know. The next question asked to us, how many of you have subjected yourself for the cancer screening program? They were probably very good students. They said, only 23% of them know it. So, out of 100 people, only 23 said they have submitted themselves. Why I started with politicians is, we also cannot become like that, like politicians. Speak something, do something. It is for you. We are talking that cancer screening program you undergo. You are looking normal, and that is the type of people who have to undergo the screening, not the patients. It can affect you, it can affect me. By name, if I have to say, when Master Christian of 10 years can get affected, why not you, why not me? I'm not cursing you. So, cancer is not a disease from outside. So, the best is to get it early detection and then get cure. Why we are insisting on so much of early detection and screening? Because 100% of the cancers are not preventable. I am repeatedly saying it is not preventable. Only 80% of them can be modified by your lifestyle factors, which everybody has been talking about from morning. Yes, but what if you already have one? That is what you are talking about in cancer screening and detect early, so that cure is a high possibility. Cure is a high possibility only if you detect early. Cure comes down the moment the stage of the disease goes up. So that is why we are talking about cancer awareness. Then what is the message as far as that is concerned? Be aware of cancer and beware of cancer. Don't run away. I won't get it, I won't get it, don't tell me. You are not God here, and it is not a sin to have another disease like cancer. You should know to fight and get it out of it. To help yourself, you have to help the doctors find it early. So early detection means cure, and hence submit yourself for cancer detection programs when it is conducted anywhere, anytime. Unfortunately, there is no mass screening program available today in this country as against the well-developed countries like UK and USA, and we are trying to push it through, and thanks to some of the Government of India programs and Government of Karnataka programs today that is coming up. Hopefully it will see light in a month or two as far as 5 districts of Karnataka at least. That afterwards, once that pilot goes through, that will be expanded to all the 30 districts of Karnataka. That is what the government policy is. Let us wait, we have to wait and see. But till that point of time, you need not wait. What is called as opportunistic program, it is available in all institutions, including MIO, which is inaugurating today. As they said, there is a separate community oncology with the 8-member team. You go there, submit yourselves, a few tests are done, simple tests, and if they are negative, be happy, and then I'll ask you to come back next year and do the same thing. That is what we can do as far as yourself is concerned. Next comes what you can do for cancer as a whole, as a disease. Can you do anything? You need not be a doctor to treat cancer, to save somebody. There are so many things as an individual you can do. The best thing would be, I am a good beggar. That is what I have been doing now. Money is an important thing to treat these high-end cancers, and particularly chemotherapy drugs are becoming costlier and costlier. So you can donate to a fund and make a small fund for your own Mangalore, and from that fund you can always treat a patient, of poor patient, which can be done. And that's what Kidwai Memorial Institute of Oncology has done it. I am not talking theory. We have raised a fund of pediatric oncology from which you put it in the corpus fund. From that interest we can treat. How much you can give? Is it thousands and lakhs of rupees I am asking? No. Give 10 rupees, give 100 rupees, is it worth it? Because it is the way you have to move forward, not wait for giving lakhs and crores of rupees. I am not at all expecting you to do that. That is what you can do for cancer. Then what you can do for this society as a whole would be to tell the person, other person, that encourage them to go to the institutions for getting cancer. In spite of all this, tomorrow suddenly your own relative gets affected. What are you supposed to do? Again money comes into the picture, and so my humble request would be, I am not an insurance company agent, but still that is the only way. Kindly insure yourself so that you can ensure the best treatment available. They can make the technology available, but the technology doesn't come with freely. Irrespective of who says, who puts it, that carries some money, and you should be ready for that. So the money cannot come overnight. So best is to insure yourself against cancer, and that is the way you can ensure the best technology comes to your doorsteps. The MIO today has started this with a higher technology, and I wish them, the directors of the institute, the investors, and everybody involved in this to start this program a big success, and I wish the Almighty to help them in all their endeavors. And before I conclude, I thank all the organizers for making me come here to share a few words with you. And I am open, if anybody is willing to ask anything off the dais, you are welcome to ask anything about cancer, in what way you can help and what way we can help you. Thank you very much, and I thank everyone for having come here. Bye.
Thank you, sir, for sharing your words with all of us. Now I request Dr. Yusuf Kumble to introduce Mr. Amit Yadav.
Good morning, everybody. Today, my task is to introduce Mr. Amit Yadav. You know, our favorite hero, Yuvraj Singh, is supposed to come here, but unfortunately, because of the test series, the date, he couldn't manage. So his gap is filled by Yuvraj Singh Foundation General Manager Amit Yadav from Gurgaon, Haryana. And like Yuvraj Singh, he is also an all-rounder. At the age of 25, his field is vast. His field is in counseling, training, operation, not cancer operation, other operations, marketing, freelancing, social work. In brief, any activities, social activities are there, Mr. Amit Yadav is there. And handling all the charity related work of Indian cricketer, Mr. Yuvraj Singh, is his priority now. He is planning the expansion of the organization and is preparing, reviewing, reporting the projects to the organization, and is coordinating with the government and other regulations officials on the projects and funding, handled public relation and licensing with other organizations, and his field includes training and education, planning, marketing and strategy building, team management and organization management in various fields. And it is a big, so many pages I cannot read full, but briefly, he worked as chief public relation with Pragati from April 2007 to 2009, and he was a project manager with Indian Project and Construction Corporation. And he is the freelancer and advisor from 2006 to 2009, and other relevant experience also he had as a Greenpeace Ambassador of Change 2011-2012. And some of his achievements are designing and implementation of QMS, IPCL and Prakriti, administrative monitoring system for IPCL, and social awareness project for Sangal, green flag waste workers. And he is he graduated from University of Delhi, followed by diploma in environmental law, and also MSc Environmental Science from Vinayaga Mission University in 2012. He was awarded India's best computer modder in 2009, part of one of the best computer gaming clan in world, and also won several gaming tournaments from 2008 to 2012. His hobbies other than the social work include photography, poetry and computer gaming. With this brief introduction, I present Mr. Amit Yadav here. I request Dr. Jayaram Shetty to present a memento to Amit Yadav. Thank you. Now I request Amit Yadav to say a few words.
Hello. I really do not have much to say. Just few words. UV can fight cancer. That's the message I want to spread. on behalf of Yuvraj Singh. Thank you so much.
Thank you, Mr. Amit Yadav. The short and the sweet message I'm sure all of us will remember. And now I request Dr. Krishna Prasad to introduce Dr. M. Shantaram Shetty.
It's a pleasure and a great honor for me to introduce Professor Dr. Shantaram Shetty. He was born on the 14th of April 1942 to Mrs. Vishalakshi and Mr. Tejappa Shetty. After his early education, he then completed his PUC in St. Aloysius College, Mangalore. Then he did his MBBS at Government Medical College, Mysore, and passed out with full honors in 1964. Subsequently, he joined the Delhi University and did his MS in orthopedics and became a full-fledged fellow of the International College of Surgeons in 1975 and the fellow of International Academy of Cosmetic Surgery in 1976. Professor Shantaram Shetty has more than 35 years of teaching experience. He joined Kasturba Medical College, rose to become its professor in orthopedics and the head of the department, became the director of postgraduate studies at Kasturba Medical College. Then he joined SHEMA and became the dean of K.S. Hegde Medical Academy. He was the first vice chancellor of Nitte University and at present is the pro-chancellor. He is a visiting professor at various universities in the United States, UK, Germany and all over India. He is a postgraduate examiner of various Indian universities and the National Board of Examinations. He founded the Tejaswini Hospital and the Shantaram Shetty Institute of Orthopedics and Trauma with the aim of providing specialized state-of-the-art orthopedic care to all patients irrespective of the income status. He has trained more than 350 postgraduate students in orthopedics, both in MS as well as D-Ortho and DNB, apart from his regular undergraduate teaching. He has presented more than 200 scientific papers in various conferences, both national and international, and has delivered a lot of lectures and many orations also. Dr. Shantaram Shetty has always told us that there is no alternative to hard work, which has to be done with genuineness, and it should be our endeavor to help others whenever we can. Each one of us should feel proud of the nation and do whatever we can in our own small way. I welcome Professor Shantaram Shetty and I request Dr. Dinesh to hand over a memento to him. Now I request Sir to kindly say a few words.
Our esteemed chief guest of the day, a person who initiated cancer research in this part of the world, a close friend of ours, Professor Abdul Rahman, on cancer treatment, on cancer surgery in particular. A person who has volunteered himself how to propel